Hi, everybody. It's Andy. It's 4 o'clock. That's the time we come together Monday through Thursday to remember that we will get through this. We will get through this together. And it's going to be important to remember that, especially in the coming weeks and months where things look like they are going to get worse before they get better with the coronavirus. But I want to start today by thanking a retired Jessamine County teacher for giving us all the right message, which is to make sure that you wear your mask. It's your duty as a Kentuckian, as an American, to protect one another and make sure you vote, which is a bedrock principle of this country, of democracy. And this year, there are more ways to do it than ever before. Let's start with our Fast Four at 4 because there's some good news in this. And today's COVID report is not good news. But one of the most exciting Fast Four at 4 that we've been able to start with is the jobs announcement for today, and that is App Harvest's grand opening. So I'm in what I hope are the last several days of quarantine, but today missed a grand opening that I had been looking forward to because I believe that this is the future direction of the Commonwealth, of jobs, of significant capital, of rewriting our future going forward. So today, App Harvest celebrated the opening of its more than $100 million state-of-the-art high-tech mega greenhouse in Morehead. This is the world's largest greenhouse, and it's in Eastern Kentucky. The location is expected to create over 300 jobs for families of Eastern Kentucky, helping to establish the state and region as an agri-tech leader and securing a better future for Kentucky. And in fact, even had a call with another agri-tech company today, in part because of the excitement of what's going on right here. At this remarkable 60-acre, 2.76 million square foot operation, App Harvest will grow approximately 45 million pounds of tomatoes annually, which are going to be shipped to customers, including grocery stores throughout the eastern U.S. Otherwise, many of those stores are getting their tomatoes from Mexico, tomatoes with pesticides. This is going to make us healthier. It's going to be local. It's going to be fresh. We are truly excited about what this does for our economy, but also the health of our people in Kentucky and health of our people in America. The high-tech greenhouse features the world's largest LED lighting installation, non-chemical growing practices, and many other innovative technology that position the company for success and make us proud. One of my favorite things about this company is that it's already integrated itself in Rowan County. App Harvest has worked with local schools, the area's technical college, and Morehead State University to create learning opportunities for so many students. And our Rocky Atkins, who has long supported the company, was there today to mark this great occasion. The opening of the Morehead location isn't the only great news coming out of App Harvest. Just the other day, Jonathan Webb, the company's founder and a good friend of mine, a visionary, somebody who's going to help us move this state into the future, announced ground had been broken on a second location in Madison County. Second greenhouse will be comparable in size to what you're seeing here and drives home the fact that App Harvest is going to be an economic driver in the Commonwealth for a very long time. Kentucky's logistical advantages played a key role in this project, and infrastructure improvements and investment were critical. $20 million project to widen a 3-mile section of KY 801 from Morehead's Industrial Park to KY Kentucky 158, transforming it from a narrow roadway to a 2-lane major connector. I'm proud to officially welcome App Harvest to Team Kentucky. And Jonathan Webb, thank you for your leadership. What you're seeing right there, Ramel Bradley too, is the future. With us needing to increase our food supply by 70% by 2050 to feed the world's growing population, this is where is going. This is where innovation is going. We are going to lead the country and the world with the science, with the technology, and with our farming expertise. That's going to help feed a growing world population and bring health and prosperity to Kentuckians. All right. Second piece is federal grants for public safety during COVID-19. So today, I'm proud to announce $780,000 in federal funding for Kentucky's public safety agencies and offices to help protect Kentuckians against scams and fraud and to prevent price gouging during our fight against COVID-19. Kentuckians have been resilient during this pandemic, but unfortunately, there are criminals who target our people, especially our seniors, in their most critical times of need. The funding that we've provided goes to law enforcement and public safety agencies to take forceful action to stop predators and protect Kentuckians. In my former role as Attorney General, my office worked to protect Kentuckians against fraud and scams, and we created the first senior protection group in the Attorney General's office. In early March, I signed an executive order prohibiting price gouging, which remains in effect today. The U.S. Department of Justice's Coronavirus Emergency Supplemental Funding Program awarded the grant funding to the Kentucky Office of the Attorney General and the Kentucky Department of Public Advocacy. I hope this shows you that this pandemic is not about politics. And we were for this grant going to the Attorney General's office, even with the challenges that they're making to some of the most important rules that we have in place. Because I'm not going to be a governor that's petty, and this is not a time for pettiness. This is a time for protection of our people. So if they will take this money and they'll use it to fight price gouging, if they'll use it for consumer protection, if they will use it to help seniors not be scammed during these times, then good. Then good. I'm for it. And I hope they work hard at it. Kentucky Department of Public Advocacy has also been awarded $102,270 to launch a pilot program in Hardin County to better address challenges COVID-19 has created in regards to access to legal counsel, the courts, and health considerations for disadvantaged clients. So I want to thank Chief Regional Circuit Judge Kelly Mark Easton and Hardin County Jailer Josh Lindblom for their support and assistance for this innovative program. I think we're going to learn a lot about best practices moving forward from it. I want to thank the Justice Cabinet for administering these grants, and I hope these groups take these dollars and go do good things. That's what we need right now. Everybody trying to work together to do good things. All right, number 3, vote. This week is starting off, according at least to the Fayette County Clerk, a little slow, and we need people out there voting early. I'm going to give the COVID report in a minute. And what it shows is things are getting more dangerous, not less dangerous. You are safer to go ahead and vote in the next couple days than probably what we'll be seeing next week. What it means is you need to vote early so we can spread people out, so there's less density, so you have less contacts, and so your voice gets to be heard, while at the same time you can stay safe. I want to encourage everybody to make a plan to vote early. Pick the day you're going to go, pick the time you're going to go. Decide how you're going to get there. Are you going to drive? Is it public transportation? Do you have even a chance to walk, depending on where you live? Make that plan. Go ahead and make it right now. And then make sure that you follow through on it. Right now, I think we are headed to a record-breaking election, one where we show if you make it easier to vote, more people do vote. And we have a chance to be the envy of the nation, to show that a little bit of bipartisanship can create one of the best elections we've ever seen and a safe election in the middle of the COVID pandemic. Think about that. A little bit of bipartisanship is certainly a nice thing to see, and we appreciate our Secretary of State for his willingness to work that way. And finally, before we hit today's news, I want to make sure we get to recognize those that are out there doing it right in our Mask Up KY campaign. So our first example is Jonathan Biven, and he's at the Big Sandy Heritage Museum. This was one where he saw that a mask was needed. He made sure that the individual got one, and that's what we appreciate. We see people all over making sure that they can provide masks to those that need them. The second one is GE Appliances, an important initiative for Kentucky schools led by my wife, First Lady Brittany Beshear. GE has now helped with 5,000 covering for kids. This is obviously GE Appliances, which is a hire company, which has worked really hard, I know, on safety, worked really hard with their personnel. And this is really special. Thank you to them and to all their workers, and the strong union of workers that are out there who we greatly appreciate. And we all want to look out for each other's safety during this, and you're looking out for our kids' safety. Thank you. Last is Serve Kentucky. This is Latricia, an AmeriCorps Vista member, delivering food to seniors in collaboration with Community Action Council, Food Chain, and the Creation Gardens. Again, special people doing special things. We appreciate all of them. All right. The third escalation is very real, and it's very concerning. It's already more concerning than the one that we had in July. And remember what we were seeing in Texas and in Florida. But here in Kentucky, I think the threat is greater. I think it's greater for a couple of reasons. First, our overall number of cases is significantly higher than it was in the summer. Second, we're not just seeing this regionally, we're seeing it happen all over the country. Third, it's not just cases that are going up, it's hospitalizations, ICU occupancy, and deaths. Those are all suggestion of surges. And finally, it's happening at a time where the weather's getting colder and more people are going to go inside. And today, we're reporting the second highest number that we've ever had of new positive COVID cases and the second highest number of deaths. This is a hard day. So today we have 1,487 new cases of COVID-19. Now, when you think about 1,487, remember a certain percentage are going to end up in the hospital. A certain percentage are going to end up in the ICU. And a certain percentage won't make it. More cases, more people who won't make it, more people who suffer what appear to even be long-term health complications. We must do better. And this week we're going to be talking about different practices that we need to get back to do better. And then we're going to be talking in the future about how we as a people can stop this, because we're going to have to. Brings our total number of cases now to 90,996. 186 of today's cases are kids 18 years and younger. Our positivity rate is 4.99%. Obviously, we'd like that much further down. We are testing significant numbers of Kentuckians. That's a positive. But when you're testing as many as we are and you're at almost 5%, it shows that there is a lot of virus out there. Currently hospitalized, 794 Kentuckians. That's up from 776 just yesterday. Currently in the ICU, 203, one more from yesterday. Currently on a ventilator, 2 less. But folks, that's not always a good sign, because the reasons for being off a ventilator can be quite tragic. When we look at new cases by county, Jefferson getting hit really hard again. And we're thinking about everybody in Jefferson County and every county that's experiencing this. Jefferson, 346 new cases. Hardin, 75 new cases. Kenton, 53 new cases. Boone, 45 new cases. Part of this is that Hamilton County, the county that Cincinnati is in right over the river, is having a huge escalation. And we have a lot of virus on our side of the river, but this thing does not care about state or county boundaries. Fayette County, 42 new cases. Elliott County, 39 cases. Hopkins and Laurel and Pike all with 35. Madison with 34. Bullitt and Campbell, 28. Barron, 27. Knox and Whitley, 26. Oldham and Warren, 24. Nelson, 23. Marion, 21. Shelby, 20. Davis, 19. Hart, 17. Christian and McCracken, 16. Meade 15, Jessamine 14, Scott 13, Boyd 12, Greenup and Logan 12, Washington 11, and Boyle and Callaway at 10 apiece. All the others are on the website. When we have 1,487 cases, it's going to mean a lot of cases everywhere. This part's going to be hard because today we're announcing the loss of 21 Kentuckians. It's our second highest day, just by one. We had lost 22 on our highest day. It includes people in their 40s, 50s, 60s, 70s, 80s, and 90s. These are 21 Kentuckians that are no longer with us, whose families are going to miss them and are going to need our help. They include a 42-year-old woman from Madison, an 82-year-old woman from Jefferson, an 84-year-old woman from Henderson, an 89-year-old woman from Henderson, and another 84-year-old from Henderson. 57-year-old man from Todd, 52-year-old male from Clinton, 77-year-old female from Madison, 91-year-old female from Christian, 65-year-old female from Boyd, an 86-year-old female from Jefferson, 85-year-old female from Jefferson, 93-year-old male from Henderson, 84-year-old male from Henderson, 76-year-old female from Marion, 81-year-old male from Adair, 69-year-old male from Clark, 70-year-old woman from Jefferson, 63-year-old man from Jefferson, 83-year-old man from Jefferson, and a 74-year-old woman from Davis. I hope we can come together in what's going to be a very difficult time for us to stop the virus based on the fact that it is escalating nationally. I hope we can come together and make sure we never have a day like this again. It's a lot of loss going on out there. 1,363 deaths now from COVID-19. Let's wear our masks. Let's engage in social distancing. We'll talk a little bit about that here in a minute. First, we have a memorial today to Ed Pantoja. Ed, who is 84 from Louisville, passed away in September after a 2-week battle with COVID-19. He was a husband, a father of 3, and led a very active lifestyle. His son shared his father was incredibly healthy, running 20 miles a week. How many of y'all are running 20 miles a week? Oh my. And working out daily at the gym. Those who knew Ed loved him. From those who worked at restaurants he frequently visited to his gym buddies and the tenants who rented from him, they all found a friend in Ed. His son shared that so many stories were shared through social media following his passing that highlighted how his dad had an impact on everybody that he met. His family loved him most of all. He had a beautiful family with his wife of 60 years. They had just celebrated the milestone anniversary in January together, not knowing it would be their last. Ed's son asked to share his father's story and emphasize the importance of wearing a mask to protect not only your life, but those that you love. I'm wearing my mask today in honor of Ed, in honor of the 21 Kentuckians that we announced their loss today. And I'm wearing one because it's just the right thing to do. And our choice is between doing the right thing and ignoring the right thing. And I'm always going to choose and teach my kids to do the right thing. Can we bring up the top 10 rules on battling COVID-19? Here they are. So back in March and early April, when we were having the escalation, and remember, it devastated New York. They lost more individuals than they did in 9/11. Their hospitals were overrun, New Jersey too. It's a very dangerous time. And it was a very dangerous time because we didn't know a lot about the virus. We didn't have a level of testing that we needed. We didn't have enough PPE even for our hospitals. And at any day, we could have fully run out. We were worried about our supply chains in so many different areas. And I know you were worried about whether there'd be food in the grocery, though we reassured you that there would be. That was the most dangerous time, in my opinion, in this virus, because if we hadn't done healthy at home, not having the knowledge we have now, things would have gotten just like Philadelphia, not more like St. Louis or better than St. Louis, but certainly looking at that second surge they're talking about nationally. So now the difference in where we are versus where we were in March is we know how to stop the spread. We know how it spreads. Listen, there's still a lot we don't know about the virus, why it impacts some people so much harder than others, why some people have symptoms for a really long time, while some kids get the multi-inflammatory syndrome. There's so much we don't know about this virus, but we do know how to stop the spread. Think about it. It's like being in a challenge or a battle of your lifetime. It's like being in a war, because we are at war with this virus, except you know 100% how to win. And the question is, are you going to execute the plan to win? This is the plan. If we follow these 10 things, we can and will stop the spread of this virus. We talk a lot about wearing a mask. People are doing good at getting tested. We talk a lot about wearing a mask and social distancing. It's not either or. Yesterday, we talked a lot about staying home if you're sick. Today, I want to talk about limiting crowds and gatherings. So yesterday, I shared the White House state report, and they had one of the strongest statements that they have had since we have gotten their reports. And what they are seeing and what we're seeing is there is so much spread at family gatherings, at events at the house, weddings and funerals. It's where we are seeing a huge amount of spread. And the White House is saying, Kentucky, we know right now you have a limit on, backyard barbecues, house parties, and the rest of 10 or less. But they think if you're in a red or an orange county, you shouldn't have them at all. And you shouldn't have gatherings beyond just your immediate family. This is the Dr. Birx, Dr. Fauci. This is the advice coming out of the White House. And what we need in the very least is for people to be a lot more cognizant of the danger of these gatherings, a lot more diligent in making sure that everybody wears the mask the whole time that they're at one of these. And we really need, in counties that are having significant escalations, for you to consider whether or not now is the time to have 10 separate individuals over to your home. So just from some of the contact tracing we've seen, just a few examples from September and October, at least 44 cases connected to weddings, at least 14 family gatherings, 63 parties, 5 bingo halls, 7 from yard sales, 6 cases from funerals, 8 cases and 2 deaths. No, these are one wedding connected to 44 cases, 1 family gathering connected to 14 cases, 1 college party connected to 63 cases, 1 bingo hall event connected to 5 cases, 1 yard sale connected to 7 cases, 1 funeral connected to 6 cases, and 1 coffee gathering connected to 8 cases and 2 deaths. Now, it doesn't mean that we're going to stop weddings. We're not. Doesn't mean we're going to stop funerals. We're certainly not. We shouldn't be having parties. But what this means is we've got to be more careful. Nobody wants their wedding day to result in 44 cases. I know that. We want it to be a happy day, so we've got to make sure that it's safe. And I'm asking all the venues out there, redouble your efforts. That prevents us from having to take other steps. Same thing with our funeral homes. My dad only went to college because of the Beshear funeral home that his dad and one of his uncles had run. Understand the importance of those services and those gatherings, but we got to be more careful, because I can tell you, coming from that Beshear funeral home, no one wants that moment, the moment when they're being recognized and they're being grieved, to cause any more grief and any more loss. So we need to ensure on these small gatherings that we are doing a lot better. And it may be, if we continue to see our numbers going up the way they are, we may need to ask that we have a period of a week or a couple of weeks where we just don't have any of these backyard barbecues or the rest at all, because we can, over the course of a couple of weeks, make a real impact in the spread of this virus. But we got to be willing to. And I know so many of you out there have worked so hard and continue to work hard. Thank you. I know that there are others that have worked hard in the beginning, or even through the middle, or maybe even through the traditional beginning of school. And you just had enough of them. Well, it hadn't had enough of us. And so while it's tough, I need you to do these things, those top 10 rules for the people around you. I know my faith teaches me that doing the right thing is supposed to be hard. When I look at the example set by my Savior, he went through so much worse than any of us are being asked to do. And so following that example, let's make sure that we suffer the inconveniences that we have to protect those around us. All right, couple of more updates. Long-term care, 70 new residents tested positive, 40 new staff. Thankfully today, 0 additional deaths attributable there. Tough update, though, on the Thompson Hood Veterans Center in Wilmore. We are now up to 71 positive veterans. 13 are hospitalized, 1 recovered, and 1 in the COVID unit in-house. 6 COVID positive veterans have died. This is one of only 4 state veterans long-term care facilities with active cases. There were 2 deaths in Hazard before before this outbreak were resolved, and there are no active cases there. There are no active cases at Western Kentucky Veterans Center in Hanson, nor at Radcliffe Veterans Center in Radcliffe. 40 cases in staff at THVC mean that those staff have to be quarantined at home, which puts a burden on the remaining staff to cover their shifts, but we appreciate you. This is a time when you are desperately needed, and I know you answer the call. This heroic staff received needed and welcome relief from the U.S. Department of Veterans Affairs program to provide medical staff for this emergency situation. We cannot adequately express our appreciation of everybody who is working to provide care here. Remember, COVID doesn't just sprout up in a long-term care facility. It's not just created in a veteran center. And the people that work at these facilities tested, long-term care employees tested at the most critical ones twice a week. They're not trying to get the virus, but when there is that much virus in the community, it finds its way in these facilities. We want to protect our veterans in these facilities. We want to protect those in long-term care. It's not just about doing everything we can to prevent it from getting in the door. It's knowing that if we don't do enough to lessen its spread in the community, it'll get through that door no matter what type of rules that we put into place. So do it for those we've lost. Do it for your faith and values. Do it for our seniors. Do it for our veterans. Just follow the rules and the guidelines, and we'll make it through this with more of us around. Now, we're right now looking at Halloween, and after that, Thanksgiving and Christmas. I want as many of our relatives to be there next Halloween and Thanksgiving and Christmas when we can do things normally. And so let's make sure on our day-to-day lives and our desire to be normal and do things normally, that we are not creating the risk that for many families, there won't be some of their family members to do normal things when it's safe. All right, a brief update on our Healthy at Home Eviction Relief Fund. So on August 24th, I issued an executive order to provide protections and clarity on the issue of evictions during the coronavirus crisis. At the time, I directed $15 million in federal CARES Act dollars to support the Healthy at Home Eviction Relief Fund. I began accepting applications on September 8th. Since opening for applications, we've received 305 applications from tenants, 3,709 of which have submitted all required documents and are ready to be reviewed. Demand has been significant, but not as overwhelming as we expected before the CDC eviction moratorium went into effect. For the 3,709 completed applications, we estimate this will utilize most of the funds of that $15 million that we have allocated. This includes projected assistance for 1 to 2 months of future rent. Therefore, for the at least foreseeable future, we're going to be closing the application portal at teamkyhherf.ky.gov. Now, if more funding becomes available, if we have another round of CARES Act funding, or we can get it through other sources, we may well be taking applications again. The good news in this is it looks like we're going to be able to help 3,700 at least folks, to make sure that not only are we able to help them in a time of need, but they don't emerge in debt. It's good news that this program has been administered as efficiently as it is, and that people knew that they could turn to it to get help. There are probably others out there that need help, and we will be looking for other avenues to try to provide that assistance. Remember, this isn't the only group that can provide assistance. There's also the Team Kentucky Fund at teamkyfund.ky.gov. There's also coronavirus relief funds distributed to local governments by our Department for Local Government. Jefferson County has their own eviction prevention fund. Federal CARES Act funds allocated to Kentucky's community action agencies are available. And the Kentucky Housing Corporation Emergency Solutions Grant Program is also out there. So go to our website and look at all of those other resources. My understanding is that there are still funds through at least some of them that are available to help you. Make sure you get the help that you need. Kentucky Housing Corporation has been the agency processing applications and getting payments out. They've sent actual payments thus far to 408 landlords, totaling $1.5 million. And we're pushing for this pace to increase dramatically to get the payments out. So I want to thank the staff at KHC. I want to thank my staff, especially Travis Mayo, who helped put this program together. We want to keep looking for ways like the utility dollars and fund we just put together, like Medicaid to provide help, like additional SNAP benefits, that's food assistance that are out there, like the things the Team Kentucky Fund can do. And I believe we're going to have at least some other utility assistance available here soon. So again, I'm trying to provide as much help as we can to Kentuckians that are struggling. With that, I'm going to turn to the questions that have been submitted. Let's see. With the governor's order saying that utility companies must enter into a 6-month payment plan. So any utility right now that wants to cut somebody off has to first negotiate a 6-month payment plan with them to give you the way to get out of the debt that it's created over time. How long could a utility company wait to disconnect someone's service if they don't make payments? So if you enter into that 6-month plan and you do not pay under it, then a utility would be able to potentially disconnect you. Nobody wants that to happen. That's why we want you to get this help. And that's why we are requiring that long, drawn out payment plan to try to keep everybody in their home and healthy. At the same time, we do have, especially a lot of our smaller utilities that are that if we can't provide some payments, and we're working on what we can do from the government side, and we certainly have that $15 million that's out, are gonna struggle to keep up their infrastructure, which they need to ensure that they can provide service to our families and service to our businesses. Given the new surge in cases, is there anything from the last several months that we wish our administration could have been done differently? You know, I'm not into Monday morning quarterbacking, and I haven't done it with the federal government either. This is a virus that didn't exist before December, at least that we know of that we didn't deal with until March 6th here in Kentucky, that there was no test in the beginning, that there is no cure, though we hope that the vaccine comes soon, that created a need for PPE like none we've ever seen and hit the entire world, which shut down the supply chain for PPE. And it was a virus that we didn't know so much about. So I believe that the decisions we've made at the times we've made them have been the best that we can. Now, there's a question about other steps that we should take or maybe need to take, and we'll be evaluating all of those. But the effectiveness of any steps we take depend on the number of people that are willing to follow them, right? The effectiveness of what we do, how we fight this virus, is a simple math equation. It's having the best practices, and this could be rules, regulations, or restrictions, times the number of people who will follow and abide by them. And so we got to get that right, that we don't push so hard on some of the practices that we know can lessen the spread, but will result in fewer and fewer and fewer people following them. And that's tough, but that's the reality. Now, the reality is we've got to get everybody banded together following the best practices that they are willing to. But that doesn't mean that we aren't evaluating new and additional steps that may be necessary or would be recommended for local leaders. Do I have any reaction to the grand juror in the Brianna Taylor case and what they said about what the Attorney General presented? I have concern. I have concern that the grand juror is suggesting that the Attorney General made direct false statements to the public about what was explained to the grand jury. And what I think that means is we just need all the information, all of it out there. Everybody should be able to speak. The AG's office ought to put out everything that was said to the grand jury, whether it was recorded or not. Trust people with the truth, the full truth. And I think it's really important given where we are as a state and as a country. And at this point, given that there is at least contradictions in what happened in a secret proceeding, it can't be secret anymore, right? We need to know about all of it. Many people say the truth will set you free. Well, the truth is the right thing to do no matter what. So no half truths, the full truth, all of it needs to come out. I think people have reached out on, I think there was a 3:30 press conference. Now, if you have a press conference at 3:30 right before we provide this update, first, I worry about your intentions because we're talking about the amount of COVID and the amount of death we're seeing in the Commonwealth. And I just ask people be respectful of that. Have a press conference at a different time, and we'll be able to answer whatever concerns or issues that are raised. But this isn't about me. This is about this virus. And part of it's about those that we have lost. So I think there was a large group of Republican senators, and as best as I can tell, it was like a Festivus and airing of grievances. We'll look at them. We'll if there's merit in them, but I think that it was just rereading some things that have been in the press, and then I think one of them doesn't think I ski very well. I can live with that. Going back to the question on anything I would have done differently in the administration, I would not have made the Tupac Shakur comment. Again, I'm sorry to that individual in Lexington. I'm glad we were able to help him out. That one was on me. I'm still a little embarrassed by it. He was a good sport and something he could have taken really personally, and I'm still sorry about that. However, the T-shirt somebody sent of me and Tupac, that was pretty fun. All right, I think those are the end of the questions that we have received, but we got a pretty special way to end today. I mean, we talk about example in our administration. I actually talk every day internally about the where that we want to take this state. The W for wages, the H for healthcare, the E for education, the R for retirements, and that last E is example. It's about setting the right example. And today, we're going to talk about Matt Coleman, a veteran and a small business owner who is setting one heck of an example. So Matt is from Louisville, Kentucky. Mr. Coleman sent this picture that you're about to see to the Kentucky Service Disabled Veteran-Owned Small Business Certification Program to show that veterans are doing their part to help Kentuckians get through COVID. After contracting the virus in September and receiving a negative test result this week, Matt Coleman with the MC Coleman Group, one of Kentucky's service-disabled veteran-owned small businesses in Louisville, immediately made arrangements to donate his plasma, knowing that it contains COVID-19 antibodies that could help others fight the disease. Matt said despite his fear of needles, he did what he could to help get us through this together. Thank you, Matt, for your service, for your kindness, for your generosity, for your great example, for being a wonderful part of Team Kentucky. You're going to save lives, and for that, I'm extremely grateful. For the rest of this week, Matt, I'm going to try to be more like you, trying to do the right things. And that's what we ask of everybody throughout Kentucky. Remember, people's lives are at stake. And all we really got to do is follow 10 simple rules to protect one another. So as I end, let me ask you, what are you willing to do to protect your family, to protect your neighbors, to protect your church congregation, to protect the place where you work and the people that you work next to? What are you willing to do? I'm guessing if we'd asked that question before COVID, we would have said, oh my goodness, I'm willing to do a whole lot of things. I'm probably willing to sacrifice part of my own health. I'm probably willing to do something that may be painful. Well, I wish in many ways we had recorded that pre-COVID, because all we're asking people to do is wear a mask, engage in social distancing, have good sanitary practices, limit the size of your gatherings, cut down on your contacts, be with your immediate family more, be with other people less. I'm guessing that would have been a lot less than we as Kentuckians would have said we're willing to do. Now we're just being tested at how long we're willing to do it. We need your help. We are looking at potentially grim times. National health experts saying that this could be the ugliest fall and winter of our lifetimes, which they're predicting significant loss of life. I think we put up on social media right now, they're saying it easily saves 70,000 plus lives just by wearing masks. So let's do the right thing. Let's realize that our sacrifice is small and the benefit is huge. Society depends on it. The economy depends on it. Our kids' education depends on it. So Team Kentucky, let's get it done. Remember, we can be, and I believe we are, stronger than this virus. We're smarter than this virus. We just have to be willing to do what our mind and our heart, our faith, our values should be telling us to do. Follow those 10 rules. And let's make sure we stop this escalation. Let's make sure we don't have that second wave that we saw in the Spanish flu. Let's do better. I want to thank everybody for today. I want to thank Matt Coleman for his example. I want to thank everybody in that veterans nursing home that knows when they go in there how much virus there is, but they go in anyways to protect and care for those individuals. They're heroes. They need us to wear masks for them. I'm going to do it. How about you? Thank you.